But if you have a high carbohydrate diet, then that blood sugar stays elevated for a long period of time. And those organs, like your muscles, have already absorbed all the glucose they need. They have stored glucose now. There's stored glucose in your liver. There's basically extra blood glucose anywhere. And what happens is those organs stop listening to the signal from insulin.
Have you ever noticed fluctuations in your energy levels throughout the day? Or do you assume everything is fine with your health even when there could be underlying issues? Today, we're here to shed light on these important questions with our guest, Dr. Paul Kolodzik. We'll explore the transformative world of continuous glucose monitoring, or CGM, and how it can change our understanding of health. Dr. Kolodzik is a board-certified emergency physician and a leading expert in metabolic health. He's dedicated to helping us uncover hidden patterns in our blood sugar levels. In this episode, we'll discuss the benefits of CGM technology, including how it provides real-time data on glucose levels and helps identify trends that empower individuals to take control of their health. So grab a low-carb snack and join us as we learn from Dr. Paul Kolodzik about managing our blood sugar for better health. Hey, Paul, good afternoon. Thanks for taking the time to join me today. Really excited to get into this topic with you.
Yeah, look forward to talking here.
Yeah, for someone who maybe they have consistently high glucose levels, what's really going on in their body? And more importantly, should they be worried about these high levels?
Let's start just by talking about what the baseline physiology is, if that's okay.
Of course.
All right, so as it'll come out in this discussion, I'm a low-carb person, okay? And there's a reason for that. So you don't remember this, Joe, but I do. Back in the 60s and 70s, you know, we were told that fat was evil and cholesterol was public enemy number one, and at all costs we had to stay away from fat. And about that time, the food pyramid came out, and it had the base of the food pyramid is all grains, if you remember, which are carbohydrates. So what happened at that point? Well, we turned as a country, we changed our diet completely from what we had traditionally eaten over, quite honestly, several centuries to focus more on carbohydrate intake and less fat intake. And so we went from 50% fat in our diet to 25%. And then at the same time went from 25% carbohydrates in our diet to 50% carbohydrates. And we can talk about a breakdown of what carbohydrates and fats are and all that. But that was spurred by the food pyramid and by this cholesterol phobia. And what happened after that? Well, the obesity epidemic happened after that. Within 10 years, if you look at the curves, it's obvious that that's when we started to gain weight. And then the diabetes epidemic started shortly after that, because once you become overweight, then you have a problem which we can get into called insulin resistance. Your blood sugars go up. So I know you asked, you know, what is the issue with the physiology of blood sugars? But the foundation is, and why we have almost 50% of the people in this country now that are either diabetic or pre-diabetic, is this increase in carbohydrate intake. And it's not that I don't believe in cholesterol. I went through medical school and residency, and, you know, I pay attention to cholesterol. But I think for most people, this blood sugar issue is a much, much, much bigger issue.
Yeah, because you do hear the debate going on of recent, times about cholesterol, and it used to be like 300 was the level you measured right now, and now it's over 200, and it keeps lowering and lowering and lowering, and people are getting confused. It's like, well, why was it okay back then? Why is it bad now? Why is it? Everyone talks about cholesterol. It seems to be a huge topic, of course. What's really going on inside your body when you have these and you're carrying these high glucose levels?
So this is what happens. First of all, blood glucose is inflammatory, okay? And so, diabetics have blood vascular problems, blood vessel problems. So high blood glucose inflames the insides of blood vessels, and that leads to occlusion of those blood vessels. Cholesterol plays a role, but for most people, the initial inflammatory response is related to high blood sugar. And that's what leads to the blood vessel problems associated with, for example, kidney failure in diabetics, or peripheral vascular disease when people get sores on their legs, or potentially even amputations because they have poor circulation, or neuropathy, and can eventually, of course, lead to strokes and heart attacks as well. So the primary pathology of increased blood sugar is basically that it's inflammatory. But this is how we get there. And I'm going to give you an explanation that's simple because this is the way that I understand it. When you eat a carbohydrate, now everybody knows sugars are not good, that sugars get absorbed into your system as blood sugar. But what a lot of people don't understand is that other carbohydrates like bread and pasta, other forms of starches like potatoes, when they get absorbed in your system, they are essentially bundled glucose molecules in their food form. And as they come across the gut and get absorbed in the system, they become blood glucose as well. They basically raise your blood glucose. So what happens is your blood glucose, it goes up. It's an energy source. So it provides an energy source, say, to our muscles. And so far, so good. Organ in your abdomen releases insulin. I'm going to try not to get too wonky here, but the pancreas releases insulin, and that's the key and the lock to force that blood glucose into your organs. You need energy. So far, so good. But if you have a high carbohydrate diet, then that blood sugar stays elevated for a long period of time. And those organs, like your muscles, have already absorbed all the glucose they need. They have stored glucose now. There's stored glucose in your liver. There's basically extra blood glucose anywhere. And what happens is those organs stop listening to the signal from insulin. Basically, that insulin's getting released, and the organs are saying, hey, insulin, we aren't listening to you anymore. We've got all the energy we need here. So that's the way to think of insulin resistance, that the organs are resisting the signal from insulin. So because blood glucose is toxic, something has to happen to that blood glucose as it rises. And what happens is it goes to the liver and gets converted to fat and deposited around the middle, causing weight gain. So you get a higher blood glucose in general, which causes this inflammation that we talked about. And then you get deposits of fat associated with that increased glucose. One problem that can come from that is what's becoming fairly common called fatty liver disease. You probably, heard or have talked about that term. Fatty liver disease is a bit of a misnomer because most of fatty liver disease doesn't come from eating fat. It comes from eating too much blood glucose that gets converted to fat in the liver.
Yeah, I've even read recently, I think children are getting this fatty liver.
Yeah.
Right? Okay.
Yeah. Yeah.
Right? And they're not alcoholics.
Yeah.
which is what we would think.
No, it's a highly processed diet, processed food diet. 60% of the food Americans eat is processed. Some will say up to 70%. Processed food is basically sugars, refined grains, which are carbohydrates, and then the bad fats, the inflammatory seed oils like soybean oil and corn oil and that type of stuff. So it's no wonder that kids are having these problems. And, I think there is a little bit of an awakening now of people realize, low-carb diets have been around now for 40 or 50 years. So that's not a fad still anymore. There's something to this. And so that's what I advocate with my patients. And, of course, we use the continuous glucose monitors in non-diabetics and pre-diabetics for them to get an understanding of their blood glucose to begin with, and then to guide their low-carb diet.
We often hear good carbs. These are bad carbs. Is there a way you could break down sort of the distinction between the two and how, you said that the sugar is inflammatory. That's how it's leading to this disease. But specifically the good and the bad carbs, like how do we differentiate?
Yeah, so again, I would try and keep it relatively simple. There are basically three types of carbohydrates. There's sugars, there's complex carbs like we talked about, the grains that are in breads and the potatoes and the pasta, and then there's fiber. So everybody knows sugar is not good, okay, because it gets absorbed immediately and will spike your blood sugar up. And fiber is good. Fiber passes through your body. You never absorb fiber. It ends up in the toilet. So that's a good carb. So you have sugars, you have fiber, and then you have these complex carbs. And complex carbs, they aren't as deleterious as sugars because they don't spike your blood sugar as quickly, but they're a problem. And the problem is that, they're packed in all the foods we eat. So when you redirect your diet to fewer carbs, and I have, specific prescriptions for my patients in terms of let's try and get this many carbs in a day and this much protein in a day, then you lower that blood sugar and you reverse that process. So what low carb diets do is lower that blood sugar a little bit. And then all of a sudden those organs that had plenty of blood glucose, now there's less blood glucose around. So those organs, like, for example, your muscles, start looking around for another source of energy. And what energy do they use? Oh, they look down at the middle and they see that fat, that visceral fat around the middle. And what I try and do with my patients is limit their carbohydrate to a certain level, often 50 grams or less, making sure they're getting adequate protein, and basically guide them related to that diet using a continuous glucose monitor.
Yeah, and that is kind of a big thing now. You do see a lot of like big personalities online. They have companies that have CGMs, these continuous glucose monitors for non-diabetics, right?
Right.
How do you think? Well, first of all, would you give us like a basic explanation of what they do?
Sure. So a continuous glucose monitor, like this one I have on now,
For those watching,
are those devices that you see on the back of the arms of diabetics. But they are fantastic tools for non-diabetics and pre-diabetics as well. So you put on a continuous glucose monitor, it puts a little sensor under your skin. They last for a couple weeks. You get continuous blood glucose readings for a couple weeks. You get to see your blood glucose readings 24/7. So this is me today. Hopefully you guys can see some of that data. So basically, I can follow my blood glucose 24/7. Now, the way I use them in my practice is first I use them diagnostically. I have a patient put them on, non-diabetics, pre-diabetics. They're great instructional tools. And, a lot of people that are not even pre-diabetic yet still can begin, even 5 years before they become pre-diabetic, to have this problem called insulin resistance. And so they can be heading that direction and not know it. And the standard test for blood glucose, which is a fasting blood glucose, one-time fasting blood glucose, once a year, every 6 months when you go see your doctor, or a test called a hemoglobin A1C, where we can get into, often can miss significant changes in blood sugar. So the way I use these diagnostically with my patients is they put a CGM on for a couple weeks and I say, don't change your diet. Let's just see where you live in terms of what's going on with your blood glucose. I don't want to be too trite with this, but sometimes that can just change people's lives. They see that data, they see those spikes, they don't think they have a blood sugar problem. So a lot of times people come to me because they just want to lose 20 or 30 pounds, but they come to me and they see those spikes and their blood sugar spiking to 160, 180. I've had people that didn't think they had any blood sugar problem and they're spiking to 240, which means they're actually in a diabetic range. So the way my patients have put it is, once I see that, I can't unsee it. They know now what's going on with their blood glucose physiology. They begin to understand this issue of excessive carbohydrates intake and why their sugar may be a much bigger problem than their cholesterol. And they self-correct. I provide them guidance, but they self-correct because they can't unsee what they've seen, and they want to make sure their blood glucose is under control. And a lot of them have had people in their family, parents or grandparents with diabetes and the associated complications, and so they want to make changes. And then after that, we use the CGMs therapeutically to guide their diet. So we put them on a low-carb diet of 50 grams or less. We guide them towards strength training, because we can talk about this. Strength training also can help if you can increase your muscle mass, reduce insulin resistance. So we make sure they get adequate protein, and basically we say, keep your carbs low, keep your protein high. We aren't going to worry about fat as much. Really, the first order of business is to get your carbs low and your protein high.
Yeah, and you said it goes on your, so it's like a little prick, and then it goes on your skin?
Yeah, it's a little filament the size of a couple hairs.
Okay.
And you put it on, you put it on and you don't feel it, and then it stays there for 2 weeks and you don't know it's there except for the data you're getting on your smartphone.
Okay, so it's just like an app that whatever company you choose,
right,
and then it'll sync as throughout the day, live time.
Yeah, 24/7 Bluetooth connection.
Wow. Yeah, no, that's amazing, because I think people can, like you said, learn a lot. It sort of gets tattooed on their mind of like, oh, wait a minute, I saw these spikes I didn't even know I had. Let me change, because now you know it's happening.
They understand what's going on, and it helps them guide their diet. And then my general approach is actually threefold. We try and integrate some intermittent fasting into this, okay? I don't ask people to fast for 3 days. If they can fast for 14, 16 hours overnight, I'm happy with that. I think you're on board with that, right?
Yeah, of course. Yeah. I do know people that will do the 24 hour, and that's a lot.
Yeah. Yeah, but fasting is the second mechanism of reversing that insulin resistance issue.
Okay.
And so we guide them with that. And then the third component is strength training. And the reason strength training is a big deal is because if you can increase your muscle mass, you can increase the quality and the receptivity of the insulin receptors on your muscles. So you're going to be soaking up more of that insulin, more of that blood glucose. It's going to help reduce insulin resistance and keep your blood glucose more stable. So it's low carb, high protein, intermittent fasting, and then strength training. And I emphasize strength training to the point where, a lot of times my patients end up de-emphasizing cardiovascular approaches. I think strength training is a big deal, especially as we all get older. As you know, we're losing, 7% or more of our muscle mass a decade after age 30. As you get older, you want to maintain that muscle mass. It has a lot to do with the strength of your bones. So especially for women, maintaining muscle mass is a big deal related to the potential for osteoporosis. So the two things patients hear from me, which they don't hear from traditional docs, is one is emphasize strength training. I want people spending 3 or 4 times as much time each week on strength training, generally as cardiovascular. We're still following the American Heart Association guidelines for cardiovascular fitness. They're still getting in what the AHA said they should do. But if you do that, you can get your cardiovascular stuff in really an hour and 15 minutes, an hour and a half a week total, maybe 3 cardiovascular sessions, and then spend the rest of, your 4 or 5 hour a week workout time on strength training. So I mentioned the two things my patients hear from me, which is different than your traditional doc, is let's not worry about your fat so much. Let's focus on getting your carbs low and your protein high. And let's not worry about your cardiovascular fitness as much. Let's spend more time strength training. And when I say strength training, it can be anything. Body weight, bands, Pilates, machines, free weights, whatever is a good fit for that person.
Going back to foods, I know you touched on seed oils a lot. And then the obvious, right? The ice creams, I'm sure, and the grains we mentioned. Are there any other food types that people should avoid and like how they would impact the body when it comes to glucose?
Yeah, so it's those 3 components in processed foods. Over the last 50 years, foods are processed for this way because they have a long shelf life and they have a higher profit margin because, they're cheaper to make. Processed foods are basically sugars, refined grains, and seed oils. And quite honestly, if you just keep those 3 things in mind, and when I'm talking about seed oils, we're mostly talking about soybean oil because that's in a vast majority of processed foods. Some safflower oil, sunflower oil, and corn oil. Avoid those. If you're going to have oils, then focus on basically avocado oil and olive oil, of course. So if you can just keep that in mind, that the seed oils are inflammatory, but olive oil and avocado oil and actually walnut oil is not, then you'll do well. But it doesn't have to be complicated. If you can just keep those general guidelines in mind, you can do real well. But the problem is you got all these forces kind of working against you. The food processing industry, there's some noise politically now about trying to change that. You've probably heard that with the Department of, I think, Human Services and the Food and Drug Administration. Yeah. So trying to make people more aware of those issues. Yeah, the way I look at this is people got to empower themselves and take it upon themselves because nobody cares more than you do.
Yeah, I mean, if you believe that what they're saying, we're the sickest country in the world, right? So, I mean, let's try something new, like maybe, why not, Let's see what happens if we do it this way.
Right. What we've done for the last 50 years or so, it hasn't worked. We're sicker and we're more obese. So, yeah, let's try something different. And, I'm not a conspiracy theorist, but all the forces are against people trying to do what they should be doing. The food processing industry basically creates foods that are addictive. That's their business model. I mean, if I'm in business, I understand that, but people don't understand, here's a bag of pretzels. It's heart healthy because it doesn't have any fat in it. Never mind the fact that you're going to get, 300 grams of carbs eating that bag of pretzels. So people need to educate and understand that themselves. And then, the other forces are, this focus on cholesterol rather than, in low fat. And there's a whole pharmaceutical industry that's behind pushing us toward, statins and medications to control that. And then, I'm in medicine, and unfortunately, the healthcare system now is set up as a disease management model. We wait till people get sick, and then we can do bypasses, or if they're obese, hip replacements. And that's what the medical system is built around. In fact, that's why I founded my practice, because, the docs in their offices, I got a lot of friends that are primary care docs, but they don't have time to do the kind of preventive stuff and the dietary guidance and these in-depth discussions that I have to do. Unfortunately, they're so busy, and I've got great respect for the primary care docs, but they're so busy, it's like, what do they have time to do? Let's tweak your blood pressure medicine, let's tweak your blood glucose medicine, I'll see you again in 6 months. It doesn't really get to the root of the problem, it just treats the problem.
We're talking about a lot of foods to avoid. Are there, and this might sound again like a layman question, but are there foods that can moderate our sugar levels that maybe are, counterbalancing these sugar spikes?
Sure. Well, the best thing to do in that regard is to focus on fiber. Fiber will slow the absorption of sugar and also the complex carbohydrates. So you want to make sure that you get fiber in every meal that you can. That's looking at foods that have fiber, or certain grain products that have a large amount of fiber. So, for vegetables, it's items like cauliflower and broccoli and asparagus. For fruits, you want to focus on the berries, raspberries, blueberries, strawberries have a tendency to have a higher amount of fiber. But when you have fiber in your meal, you're slowing the absorption of both the sugars and the complex carbohydrates, and that can be helpful. And then just the order that you eat your foods in can help in that regard. So if you're getting your protein and your fiber in before you're getting your carbs in, then that actually can slow the absorption as well. And rather than getting a high spike of your blood sugar like that, it'll give you a lower, maybe a little bit longer, but a lower spike. So food order and then getting a lot of fiber are the keys.
Yeah, I was going to ask you that specifically about the food order, because there's, again, personalities you see online. The glucose guys, I think, comes to mind.
Yeah, so she's been out front on this, I think has raised a lot of awareness. I think that that's really a good thing. And I think what's going to give this another boost is now that, continuous glucose monitors have gone over the counter here in the last 3 or 4 months. So you can get one. You don't need a prescription from a doctor anymore to get one. You can get one on your own, and you can walk through the steps that I discussed, maybe initially using it diagnostically and then using it therapeutically. And then, of course, I'll make a plug for the book, Joe.
Yeah, of course.
Continuous Glucose Monitor Revolution, best-selling book on CGMs on Amazon. So we're talking about CGM use, again, by non-diabetics and pre-diabetics. And this book has been out about a year, and it's really a guide as to how to use a CGM. Chapters on the things we've talked about, the different dietary approaches, strength training. The GLP-1 medications are all the rage now, so I do talk a little bit about how that can integrate with the use of a CGM. But the purpose of this, again, is to empower people really to be their own best advocate related to their diet and their health.
Yeah, now that kind of leads me into my next question about keto, right? I was going to ask you, can these CGMs sort of help people better understand when they're in ketosis, and or just maybe like what your thoughts on keto diet in general might be?
Yeah, so I guide most of my patients to a low-carb approach, but I have patients that want to be keto. I've had many people, patients and colleagues that they just feel better when they're in ketosis. So the answer is a CGM can help guide that diet. Usually keto is like 20 grams or less of carbs a day. So you can use a CGM to guide that diet, so you can actually check to see where your ketones are. And there's several mechanisms doing that. There's urine strips, there are breathalyzers. I quite honestly think there are finger sticks as well that measure ketones. And for people that get serious about being in ketosis, getting a finger stick device, I advocate one for my patients called a Keto Mojo. It's available on Amazon. But when you're going into ketosis for the first, maybe week or so, you need to be sticking your finger a couple times a day. But once you get in ketosis and you're holding there, you can just maybe check and see where you are once every 2 or 3 days. For my patients, and for me personally, actually, what I like to do is basically stay low carb, but then I'll cycle into ketosis periodically, maybe for 2 or 3 weeks, once every 2 or 3 months or so, just to make sure I got a baseline and I'm getting low again. And I think cycling or keto cycling, low carb keto cycling is a good approach.
And some people, will they cycle into high carbs though, or is it just low to keto, and that's sort of what the area you like to be?
I'm not a high carb advocate
No, for sure.
at
I know.
all.
Yeah. Yeah.
Yeah. So, the American diet has gone from about 150 grams of carbs a day back when we were talking about, this in
Pyramid,
the 50s and 60s
Yeah.
to now, it can be 350 grams of carbs a day. I have some patients, they aren't interested in weight loss. They just want to be healthy. And they might be, 75, 100, even 125 grams of carbs a day. You don't really need more than that. I don't think anybody really needs any more than that. So I think in general, guideline for my patients, a number to hang your hat on is, 50 grams or less a day. And then if you want to cycle into keto, going down to 20 grams periodically, I'm fine with that.
How are you sort of directing your patients to measure, right? Because people are like, 50 grams. Okay, but how do you visualize? Are you weighing? Like, what's the method to kind of get that 50 grams a day?
So great question, because people that measure invariably end up doing better than people that don't measure. So you got to be a little bit obsessive compulsive, especially at the beginning. There are a number of apps out there that will help you do this. There's one my patients use called Carb Manager. There's another one called Chronometer, and I think you do need to be using an app. You can often scan labels related to that, and so the apps help you keep a log, but I think you really need to do that. Now, after a while, when you do end up eating a lot of the same things over and over, you get settled in and you kind of know where you are, but people that count their carbs and their protein end up doing a lot better than those that don't do that. So I advocate that. And there's a few new apps out that I'm just familiarizing myself now where they're using AI to take pictures of your food. So you can actually have a plate of food, take a picture of your food, and it will give you the macronutrient breakdown. This many calories, not that I don't care about calories that much, which is another, difference between me and most docs. But it'll give you, how many carbs, how much protein, how much fat, how much fiber. And related to calories, they're basically, a lot of patients come to me for weight loss. They're basically two approaches to weight loss. One is the calories in, calories out energy balance model. And the other one is the low carb model. And I don't think calories in, calories out really is sustainable for a lifetime. So we really don't pay much attention to calories. You keep your carbs low and your protein high, and generally your calories are going to be in an acceptable range.
Yeah. And for people listening, do you have like people who are more at risk? Like, how much of a genetic factor? Are we all potential candidates to use a GCM? CGM?
Yeah,
Sorry.
I think just to find out, where you are. Now, if you use one for a couple of weeks and your numbers are low and you don't have any problems, then you might not need one on an ongoing basis. That being said, there's a certain group of technologically oriented people that are very focused on their physiology. So despite the fact that they don't have any blood sugar problems, they just want to keep their blood sugar very low, 70s, 80s, 90s, seldom over 110. But the need to use a CGM is dependent really on the initial data that you find out. And of course, if you have risk factors like a family history of diabetes, or if you're overweight, then it's a bigger deal. The other thing I'm going to advocate for people to consider is there's another test that I do in all my patients when I first start taking their data is a fasting insulin level. Okay? So a fasting insulin level, that is a insulin level at the time you haven't eaten for 12 or 14 hours, gives you great data related to where you are in the insulin resistance spectrum. So in addition to wearing that CGM for a couple weeks without changing your diet, I'm a big advocate of fasting insulin levels. I do that in all my patients. Again, I think CGM data along with fasting insulin level is probably more important than a cholesterol level in most people. The answer is genetics does play a part, but what you should do is just gather this baseline information and then you'll know how to approach it.
Yeah, and obviously food. Are there any sort of activities that we do that could raise these levels that a CGM would pick up?
First of all, I'll mention a couple things. I do have patients that will get spikes in their blood glucose with exercise. Okay, either a good strength training workout or a cardiovascular workout. So to understand the physiology of what's going on there is when you're exercising or stressing yourself a little bit, you're getting a little bit of release of cortisol in your body from your adrenal glands, a little release of adrenaline from your adrenal glands. That causes a blood sugar release. So that will cause your liver to release a little bit of blood sugar in your system. So people come to me and they say, I just worked out and I got this spike in my blood sugar. What's going on? What do I do about that? That's just a natural response, and that is nothing to worry about. Generally, activity over a period of time helps deplete those excessive glycogen stores. The glycogen stores are the excess glucose stored in your liver and your muscles. And over time, that will help you lower your blood sugar levels to more acceptable levels. But, occasionally people will get a bump when they're exercising, and that is nothing to worry about.
Yeah, okay. You mentioned a little bit about the GLP-1s.
Yeah.
I don't know what your opinion is on them, and I guess some people are saying it could help, managing type 2 diabetes. Is there, like, what you're seeing in patients, like pairing CGMs with these GLP-1s? Is that some sort of correlation that's working?
So this is my approach or thought on the GLP-1. So first of all, the genie is out of the bottle with the GLP-1s, and we're never going back. People are going to use those. And the question is, are you going to commit to a lifetime of GLP-1 dependence? Okay, or are you going to use it for kind of a jump start on your diet or to work through a plateau? So yes, I use CGMs and pair them with them because for GLP-1s, and I have prescribed them to some patients, but my goal is use them for a limited time and use them in lower doses. So you got to titrate. These are medicines you kind of titrate up over time and then down. And so I try and keep that high dose, what we call the ceiling dose, as low as possible, and then titrate them back down. And you can use a CGM on both ends of that, first to get a baseline as to where you are to start before you even start a GLP-1. I think everybody ought to wear a CGM for a couple weeks, get a fasting insulin level before you start a GLP-1, because then you know what your baseline is. And then as you're titrating down and off to help guide your low-carb diet, it can be helpful. The GLP-1s originally were diabetic medications, so they are going to lower your blood glucose. But the trick is titrating down and off the medications without the weight gain that can occur when you're getting off the medications. And CGMs are great tools to help guide that process.
So for someone listening, right, you recommend that just 2 weeks of continuous, right, of the CGM wearing, and then you'll test again the blood, and then put them on the diet or whatever food plan, and then test. And then will they wear the CGM again after that?
Yeah. So again, that's the therapeutic phase. And I have patients that wear a CGM depending upon how high their spikes are, and they use them intermittently for 2 weeks a month or 2 weeks every couple months. I have patients that put a CGM on their arm and they never want to be without one again. They just feel that data is that valuable. But certainly, again, there's 2 weeks of diagnostic phase. Eat whatever you want. Let's see what your numbers are. Then let's use one for a while, generally a month or two, to help guide your low-carb diet. And then after that, we can continue them, or we can have you use them intermittently. And then when people are on GLP-1s, the value of the data becomes a little bit less significant because the GLP-1 is forcing that blood glucose down. So you aren't really getting a true picture of what a patient with not on medication would be like. So we have a tendency to use those at the beginning to, diagnose where they are, get them into a low-carb diet, because all the GLP-1 patients that I've treated were doing the same thing: low-carb, intermittent fasting, strength training. And then when it's time to come off the GLP-1, use the CGMs as a guide to make sure that you're staying in line. Basically, if you continue to follow the guidance and the routine that you've pursued with low-carb, intermittent fasting, and strength training, you can get off those medications and maintain, your weight and your muscle mass.
Yeah, and it like everything you're talking about, especially when it comes to the CGMs, it sounds positive, right? Are there patients where you're having to try to sort of dispel myths or negative thoughts they have about using these? And if so, what are they?
There's a chapter in the book on this. There really isn't a downside. I mean, there theoretically could be an argument that, well, this could promote some kind of eating disorder, because people are hyper-focused on this. But, over nearly 10 years in my practice, nearly 1,000 patients now, I haven't seen that at all. I think, knowledge is power, data is power. I haven't really seen any deleterious effect. And quite honestly, once people spend a number of months on a CGM, you get ruined. I mean, you can't
go back,
ever eat a donut without knowing what's going to happen to you, or a piece of pizza. And that doesn't mean, I tell my patients, live your life, special occasions, wedding, you're going out, to breakfast with your family on a weekend, and you're going to break your fast a little bit early. That's fine. Live your life. But quite honestly, once people see this data and have this knowledge base, their eating approach has changed. I had a patient tell me just this last week, I love this whole new way of eating. And the whole new way of eating is just, low carb and watching your blood glucose. But it was new to her because, she had been listening to the medical establishment and the processed food industry, for the last 40 years, that were bringing her down this path of, sugar frosted Cheerios are great for you because they don't have any fat in it. But she learned how to go low carb, and she'll never go back.
Yeah, the Cheerios are heart healthy too. Someone that does take the CGM, they do change what they're eating. They do low carb.
Yeah.
Do you see that total cholesterol go down?
So this is what I usually see with those patients. I usually don't see any significant change in cholesterol. In fact, there was a metabolic health social media guy that, ate, I think he ate something
the
like
eggs, right?
Yeah, the eggs.
Yeah,
Did you see that?
Yeah,
Dr. Nowicki? Yeah.
Totally, yep.
Yeah, and his cholesterol didn't change at all. And I'll tell you, that's what I see with my patients. Total cholesterol, I usually don't see change significantly. LDL, which is the bad cholesterol, I usually don't see change significant. Could it go up 20 points or down 10 points? Yeah, all that can happen. What is remarkable is the drop in triglycerides, which is another form of fat that's in your blood. Because triglycerides are formed from the conversion of blood glucose to fat in the liver, that process we talked about, early in this discussion. And when you decrease the substrate, if you decrease the amount of blood glucose that's around, there's less triglycerides. So I have people drop their triglycerides like in half. I'll have people that, one patient 6 out, he came in, his triglycerides initially were 220 and he dropped them to 68. So you almost invariably see the triglycerides go down. And regarding cholesterol, with this cholesterol phobia, people need to be aware that all cholesterol is not created equal. So the bad cholesterol is LDL, the good cholesterol is HDL. But there are subunits of the bad cholesterol, and I don't know if you've heard these terms, but lipoprotein A and apolipoprotein B. So those are subunits of the LDL cholesterol. And you can have a high total cholesterol, but if you have favorable subunits, if your LP little a is low and your ApoB is low, then you don't necessarily have damaging types of LDL. So for anybody, before anybody goes on a statin, I would increase your knowledge base about that. And I send my patients, if they have a little bit high numbers, to get what's called those subfractions, just to prove that I'm not anti-cholesterol. I have a doc in town that I work with here who's a lipidologist, an expert in cholesterol, and we've got a great collaborative relationship because he understands what I'm doing, but I also understand that if somebody has a high cholesterol and they have these deleterious, these bad subfractions, that should be paid attention to. But a lot of times people will have a little bit of a high cholesterol and their subfractions will be just fine, and they really don't need to be on a statin. And that higher LDL really is not that much or any concern if their subfractions are favorable. So anybody that's got a high cholesterol, just, educate yourself about the subfractions and begin to ask your doc questions and consider getting those checked out.
Yeah. How do you see CGMs like sort of reshaping as they catch on more with people who are some just listening now, hearing about them for the first time, but flash forward 5, 10 years, like how do you see
Yeah.
these sort of reshaping the approach to health and weight management and even like how we eat?
Yeah, because it's data driven, because CGMs are data driven. The AI components of that will be able to provide guidance, maybe replace somebody like me, because, I'm sure AI is going to provide, based on your CGM profile, your fasting insulin level, what your cholesterol look like, is going to be able to give you an exact prescription for the approach that you should take. But again, people have to empower themselves. It's a little bit of work. You need to understand these different components. Even if AI spits out a prescription for you, to get motivated to follow that, you need to go ahead and increase your knowledge base. Since you brought that up, Joe, I'm going to mention, so medicine has changed so much over the last 40 years. I came out of my residency in the 80s. The changes that have taken place since that time have just been great. A lot of times docs back then were in their own offices working for themselves or in a small group practice. Now most of them work for health systems. The pharmaceutical industry wasn't what it was. The food processing industry wasn't what it was. So medicine has changed a lot, but all these areas that affect your health also have changed quite a bit. So again, you need to go ahead and embrace figuring out for yourself what is best. And I don't think I mentioned my background in emergency medicine. Basically, that's brought me to this metabolic health approach, because for 25 years, I've been in the emergency department, seeing the disease that comes in that quite honestly is largely preventable. And I drilled down to that, came down to two things. One was blood sugar and the inflammatory process caused by blood sugar. Now, again, with 50% of Americans either diabetic or pre-diabetic. And the other one goes along with that is the obesity that takes place. And, the medical problems associated with obesity, the GERD and the sleep apnea and the fatty liver disease, and even the musculoskeletal, hip and joint problems. It became evident to me working in the emergency department and seeing those problems over many years, the peripheral vascular disease, the strokes, the heart attacks, the kidney failure, that if people can just manage their blood sugar and manage their weight, they can prevent a majority of chronic medical illness.
Yeah, data is starting to show that's exactly what it's been all this time. What's one piece of like sort of lasting advice you give to someone thinking about trying and what they would get out of this to push them forward to say, all right, you know what, let me just get these numbers and give it a shot?
Yeah, give it a shot. So you can get a CGM now for $50 over the counter. Okay, so the investment is $50. You're going to see where your blood sugar is. So it's really just do it. Increase your knowledge base, empower yourself. And I think once you have a look, the majority of people are going to say, you know what, I can improve upon that. And then you'll begin to learn more about your diet, more about this issue of insulin resistance, how you can lose weight using your visceral fat as a source of energy as opposed to, excessive carbs every day. So really just try a CGM. Try it for 2 weeks. If you don't like it, what have you got to lose? But I really have had very few patients over the course of the last 10 years now that didn't see this to be of great value.
Yeah. How about for people listening, right? I mean, you obviously, you're an encyclopedia when it comes to medicine. Where can people find you directly, connect with you online, buy your book, stay in touch? What would be the best place to find you?
So my medical practice website is metabolicmds.com, just the word metabolicmds.com. But I'm actually branching out to be able to provide CGMs to patients, actually to people that are not patients, and then provide guidance in Zoom sessions and educational sessions. And that website is cgm-doctor. But the best thing to do, really, quite honestly, is get online, get a CGM, and then if I could be so bold as to say, use this book as a guidance. It's the best-selling book on CGMs on Amazon, The Continuous Glucose Monitor Revolution. And, that's really all you need to do. Get a CGM and start educating yourself. I think that the book will help with that. It really is a blueprint as to where to go. And once you start going down these rabbit holes and begin to understand these things that you maybe peripherally have heard about in the past, but now you have a knowledge base on, it can change the course of your health.
Yeah, no, this is great advice. Thank you so much for sharing that today and for your time. I really appreciate it, and it's been extremely helpful. So I'll make sure all these links are in the show notes. And great to meet you, and thanks again for today.
It's been a pleasure. Thanks for having me on, Joe.